Hello everyone, welcome to Raaonline. I am Dr. Abhinaya. I am a consultant pediatrician. So in Nelson-based pediatric teaching, the next topic of discussion is on cystic fibrosis. So I have divided cystic fibrosis into two parts. The management part alone will be in the part 2 of this presentation. Okay, so let's get started. So cystic fibrosis is a progressive disease and progressive multi-systemic disease. So we are dealing in the respiratory system because most of the systemic features actually start and the predominant complications or the predominant symptoms pertain to the respiratory system. So I have placed cystic fibrosis in under respiratory system. So this is a very progressive disorder. It is a genetic disease which is inherited as an autosomal recessive disorder. So this causes a persistent lung infections and respiratory failure also happens over time. The phenotypes of cystic fibrosis are very variable. Most of them have the respiratory symptoms. Some can have a normal sweat chloride, some can have a high sweat chloride, some can have more of a GI manifestation, some can have lesser GI manifestation. So it is a it has a very variable phenotypes among the children. It definitely causes severe morbidities and reduces the quality of life in these patients. So the main cause of death in cystic fibrosis happens due to respiratory failure. We will see how and why in the presentation. So physician Dr. Dorothy Anderson was the first to discover cystic fibrosis, and she described in the year 1938. So she described cystic fibrosis among a set of patients which involved the pancreatic ductal function. Okay, initially it was described in the pancreas. So she discovered way back in the year 1938. So meanwhile, from over these years, over the last 30-40 years, the prediction, the survival age of cystic fibrosis has dramatically increased. Maybe because of the awareness, because of the better prophylaxis of the drugs, better understanding of acute exacerbations and immediate responsive treatment that we give to these children, the chest physiotherapy, the mucociliary clearance techniques, etc. So maybe the comprehensive treatment that we have started providing to these patients has improved the survival. So as you can see here, around 1990, the survival age was somewhere between 28 to 32. So towards the end of the third decade, it slowly increased, and now in 2017-2021, the survival age of these patients, cystic fibrosis patients, has increased up to the 5th decade. So it is a dramatic improvement, isn't it? So understanding of cystic fibrosis patients and treating them, attending to their concerns, a holistic management is very important. And I am sure you have all seen cystic fibrosis patients. But if you are a treating physician or if you are a primary physician, identifying and getting the genetic study done and getting the sweat chloride, at least even suspecting that this could be a cystic fibrosis is definitely welcoming. So that is where the first point of care, a practicing pediatrician or a general pediatrician is the one whom the cystic fibrosis patient comes to first, isn't it? So we have to suspect CF, do the investigations and immediately refer them to a center which has a CF expertise. So coming to the incidence of cystic fibrosis, it actually varies. It is highest in the Caucasians, that is between 1 in 2500. So this is the highest. In the Indians, mostly there are no Indian studies, but studies which have included Indians are mostly NRIs in UK and USA. So the incidence is between 1 in 10,000 to 1 in 40,000, and it is low. I mean, most of the time it is the lowest incidence among is in the Oriental population. So highest in Caucasians and around 1 in 90,000 in the Oriental population. In India, the precise incidence is not known. So let's talk about the CFTR genetics. Let's talk about the CFTR protein. Let's understand why or what function does the CFTR protein does and why are the manifestations different for each individual. So the CF